Hi, I'm Jazz.
I'm Manru.
I'm Cassandra.
And I'm Andrew.
And we have another group member that wasn't able to join us today. She will be doing the voiceovers, and her name is Gitika.
Monitoring heart rate is a good indicator of cardiovascular health. Cardiovascular health is an important aspect in everyone's well-being. Studies have shown that high resting heart rate is a robust risk factor for cardiovascular disease and mortality. And they have also found that exercise intensity is an important variable in determining the health benefits of exercise and is a predictor of exercise-induced mortality. So heart rate is a reasonable indicator of exercise intensity. Therefore, it's very important that everyone has access to accurate heart rate monitors in order to be aware of their own cardiovascular health needs. And as sports science students, we are also very well informed on how important it is to participate in training that uses your cardio. So participating in cardio and just ensuring that our heart rates are either increasing or decreasing at normal values. Anything that's too excessive or below the norms must be tested by physicians. Therefore, if you have any underlying health conditions, those also have to be examined by physicians. Therefore, heart rate monitors are a good indicator of any symptoms that an individual might show up. So now the research question that we are posing is, which type of heart rate monitor is the most accurate at detecting heart rate? Since a lot more individuals are relying on technology to help them get through everyday life, we have noticed more and more people purchase Apple Watches, Fitbits, any smartwatches just to track their own health and wellness. They've been used 24/7 for sleeping, for eating habits, and even just how much exercise you get throughout a day. So we figured that this technology advancement is essential to test, and we just want to see how accurate a heart rate monitor on these smartwatches truly is, as well as assessing the difference between heart rate during aerobic activities versus anaerobic activities, because we want to see just how much our heart rate changes and how accurate it would be if we were to participate in different activities.
Methods used to calculate heart rate is the heart rate and O2 saturation device, otherwise known as the oximeter. The pulse oximeter is a valid technique for testing heart rate for exercise, high altitude sports, and helicopter transport. According to an article published by the Journal of Athletic Therapy and Training, pulse oximetry is a non-invasive method using arterial blood pressure oxygen saturation to determine the percentage of hemoglobin in the blood and the pulse rate. So for the purpose of this research study, we will not be analyzing O2 saturation because it isn't a feature on all of the devices used. The pulse oximeter uses two wavelengths of light. Kiss and Colley state that for the two wavelengths, there is one in red and one in the infrared spectrum, and a detector that measures light intensity passing through the fingertip. The researchers also state that the oximeter assumes the pulsation in the light absorbance signal, and it is produced by oscillations in arterial blood volume due to systole and diastole. Different absorption of light at these two wavelengths and pulsatile changes provides enough information to determine the ratio of oxyhemoglobin to total hemoglobin and calculate pulse rate. There are two ways to use the oximeter: the wrap and the clip that can be attached to the big toe, the fingers, and the nose and the earlobe. So Chiefman and colleagues mentions that the clip style sensors are most effective for the fingers, not the thumb, and the earlobe. Lastly, William and Kiss and colleagues state that being able to monitor both oxygen saturation and pulse rate with a single instrument is economically advantageous by eliminating the need for an EKG.
Another method that can be used to compare the accuracy of heart rate is the Apple Watch, that measures heart rate through the connection of the skin surface. The way the heart rate is measured on the Apple Watch is through a photoplethysmography, a PPG. A PPG is a simple technique that detects volume changes in blood in the peripheral circulation through the surface of the skin. Blood is red because it reflects red light, but at the same time it can absorb green light. The PPG takes the measurements of the heart rate through green light emitting diodes, LEDs, that are put together with light-sensitive photodiode into an electric current, detecting the volume of the blood flowing through the wrist. So when the heart pumps blood into the capillaries or beats, the blood flow pressure or the volume of the blood increases, resulting in more green light to be absorbed and getting converted into the electric current. The watch can detect the heartbeats because it flashes LEDs hundreds of times per second to calculate beats per minute, which equate to heart rate. However, this process is mostly done when one is working out or doing breathing sessions, but it still measures heart rate when worn on a daily basis of doing everyday activities, but through infrared light, which basically uses the same method as the LEDs. However, for this, it measures it every 10 minutes. It does not classify anywhere what side the watch has to be worn on, so that is totally up to the watch wearer. There are certain things that can affect the heart rate monitoring. Skin perfusion is which, when not enough blood flows through the skin, this can happen when one is cold. So it varies from people to people and the environment they live in. Other things such as tattoos, which can block the light sensors and the activity that the person is doing. For example, it works well when biking or running, however not so well when boxing and tennis because of the motion of the hands that can possibly shift the Apple Watch to lift off the surface of the skin, making it harder to read and record. Smartwatches are being used more and more to track things like heart rate, but how accurate is the measurement? In a study done by App et al., measured heart rate with only the Apple Watch that was worn on both wrists to see if there was a difference. Researchers used physically active people, both male and female, that performed a single maximal oxygen uptake test on a treadmill. Results show that the Apple Watch was pretty accurate in measuring the heart rate, with a difference of -1 beats per minute. This study suggests that the Apple Watch is a good indicator of heart rate. Another study done by Thompson et al. found results where the Apple Watch was compared with the Fitbit did much better. The Apple Watch may be a good indicator of heart rate that can help individuals keep track of it, which can help them with detecting any cardiovascular health problems.
Another method that can be implemented to monitor an individual's heart rate is the Fitbit watch. They use the same technology as the Apple Watch, but they also use their own technology called Pure Pulse. The PPG is used as well, so when the heart contracts or beats, the capillaries grow in size due to the change in blood volume. The green LEDs flash in a number of times per second using photodiodes to detect the change in volume. Once again, it uses infrared light to detect the heart rate when it is not working out. The Fitbit has a range of 30 to 220 beats per minute when sleeping and 40 to 220 beats per minute when awake. The technology is widely used because the LEDs maximize detection of capillaries near the surface of the skin. In a study conducted by Benadioid, researchers tested the Apple Watch against Fitbit, in which it underperformed. The results showed that it underestimated the heart rate by 30 beats per minute. The greater sensitivity of the Fitbit charge HR2 compared to Apple Watch may be due to the hardware differences, which in many cases always has an impact on the signal-noise ratio. The Apple Watch uses two green as well as infrared LEDs paired with light-sensitive photodiodes to detect the amount of blood flowing through the wrist, whereas the Fitbit Charge HR2 has two green LEDs but only one photo detector. The infrared light and one more photo detector is present on the Apple Watch, which can be used for filtering out noise, which may elevate the accuracy in measuring heart rate. There are certain factors, just like Apple Watch, that can affect detection of heart rate in the Fitbit as well. For example, the watch can fall off the wrist while running or doing some kind of physical activity, which can affect the result.
So another method that can be implemented to monitor an individual's heart rate during physical activity is the Polar Heart Rate Monitor. This device is a portable heart rate monitor that is strapped around an individual's chest directly under their sternum in order to allow it to pick up signals from the heart in order to get a reading. Because it is light, the individual is able to wear the heart rate monitor throughout their whole workout or training session in order to get a reading from the start to the finish of their session of their heart rate. This heart rate monitor uses electrodes to measure an individual's heart rate, and it is recommended to make the part of the heart rate monitor that is directly in contact with the skin slightly wet in order to allow the monitor to optimally pick up signals from the heart. According to an article published by the European Journal of Applied Physiology, it is suggested that a polar heart rate monitor is a useful tool for individuals who are participating in high endurance activities because it helps to effectively monitor their heart rate. In an article published by the Journal of Strength and Conditioning Research, it is stated that using a polar heart rate monitor is a useful tool to have while training. The data can be collected and provide information about whether training sessions are effective, and if they are not, the individual gets an idea as to what aspects of their training that they should change.
So we found some studies that looked at the Apple Watch, the Fitbit, and an electrocardiogram. And we have not, however, found any research using all 4 of the variables that we are using. And we also didn't find any previous studies that use these devices with both aerobic and anaerobic systems during physical activity.
We wanted to see the accuracy of heart rate monitors simultaneously. We will be using both the energy systems, aerobic and anaerobic. We will be using the Apple Watch, Fitbit, Polarbeat to see which one measures the heart rate accurately, which will be compared against our control, the oximeter that provides the most accurate reading.
Within our project, we'll be working with 5 college students, 4 females and 1 male, between the ages of 22 to 25, which are moderately active within their daily routines. All participants will be put through the exact same routine and will not be treated differently in any way. Our participants will first warm up on the bike for 5 minutes to increase heart rate, lubricate the joints, and to get blood flowing to the working muscles. We will be conducting both anaerobic and aerobic workouts within our study. For example, on day 1 of our data collecting, we will have 2 participants doing anaerobic activity and 3 doing aerobic activity. And on day 2, we will have 3 participants on anaerobic activity and 2 on aerobic activity. After having participants warm up on the bike for 5 minutes, we will have the aerobic participants bike for 10 minutes while wearing all the devices at the same time. And for the participants in anaerobic activity, they will be doing 30 seconds of interval, full-on effort biking. After having each participant complete their task, we will also be measuring their resting heart rate. And when it comes to health concerns and risks for this project, we have 2 female participants who have asthma, and they will be taken care of if need be.
So, in order to allow for as much accuracy as possible during testing, our participants will be given pre-test instructions that they are meant to follow. So, one of the first instructions would be to avoid the consumption of alcohol for 6 hours before testing and to avoid caffeine intake for at least 2 hours before testing. This is done because caffeine and alcohol are diuretics that cause dehydration, and this dehydration can affect the participants' performance in the test and affect their heart rate. They should also be instructed to avoid eating anything 2 hours before the testing because eating displaces the blood flow from our working muscles to our digestive system, and this could result in cramping and lack of access to the necessary energy stores and also affect our heart rate. They should also be asked to avoid exercising for at least 6 hours prior to testing. This is done because the participant's body could still be in recovery mode from their previous workout, and they may not be able to perform as optimally as they could had they been well rested. The participant should also be instructed to wear comfortable clothing as well as comfortable footwear because this will allow their core temperature to remain stable and not rise as much, which would affect our results and not make them as accurate. And finally, we should ensure that the location is privatized, well ventilated, and set at a comfortable temperature for the testing subjects in order to minimize the effects of any outside factors.
Okay, so anaerobic exercise is an activity that breaks down glucose for ATP without using oxygen. It is generally done in short intervals of time with high intensity.
So to conduct our anaerobic system test, we will be doing the Wingate bicycle test. And for that, you will need the Monarch Cycle ergometer, which is the bike that the participant will be using, and all 4 heart rate monitoring devices being used simultaneously. To set up, ensure that the seat and handlebar height are adjusted for each subject, and that the resistance is set at 0.075 per kilogram of body weight. Therefore, ensure that you have your participant's body weight prior to conducting the test. For the procedure, you will be asking your participant to perform a 5 to 10 minute warm-up prior to commencing the test. This has already been chosen, and you will then get your subject to pedal at maximal power for 30 seconds. So ask them to go all out and ensure that you encourage them along the way. We will be taking their heart rate reading prior to the bicycle test and immediately after the 30 seconds are over. Normally, you would ensure that the total revolutions are being counted and recorded every 5 seconds, but since we are only looking at the heart rate, we will only focus on the heart rate pre-test and post-test.
The aerobic system is when the body uses oxygen to create ATP for energy use. This allows an individual's ability to sustain prolonged effects.
To look at our aerobic system, we will be conducting the Estrand Rhyming Maximal Cycling Test, which is again done on the Monarch Cycle ergometer, and all 4 heart rate monitoring devices will again be used simultaneously. For setup, ensure that the seat is also adjusted at the appropriate height for each of the subjects, and then ensure that the workload is tailored to each of the subjects. So gender and training level also are a factor in determining what the appropriate workload would look like. This is the chart that we refer to when deciding which workload we are setting. So if you are a male, you would use the 100 to 150 watts, female 75 to 100 watts, and then if you are older or untrained, then 50 watts would be appropriate for you. In terms of the procedure, the pedal speed is set to 50 reps per minute, and you're going to maintain that workload for 6 minutes. So this is a slightly longer test as it does run for 6 minutes, and the other participants are required to record the heart rate at the end of each minute. So you will get a total of 7 readings because you will be getting the pre-test heart rate reading and then 6 additional ones following the test. The test is finished when the individual has a heart rate between 130 and 170 beats per minute, and the difference between the heart rate values during minutes 5 and 6 should be less than 5 beats per minute. This ensures that they have a steady state, and then that would mark the end of the test. If, however, the difference between the heart rate values is greater than 5 beats per minute, you will then ask your subject to continue pedaling for 1 minute or longer until they are able to achieve that steady state. If your heart rate does not reach 130 beats per minute, then you must increase the workload until it is going to be above 130. And then, of course, since it was an activity that lasted 6 minutes, the cool down would ensure that there's no resistance, so then the participant can cool down and just cycle until they feel they're a little bit more relaxed.